In the mid-1990s, the number of people who were dying from AIDS reached epidemic proportions. In the years that followed, 3/4 of the people living with HIV and AIDS were in sub-Saharan Africa. Zâmbia was one of the worst affected countries in the region. At one stage, 1 in 5 of the population were infected. Chikankata is in southern Zambia and has a long history of treating people with the disease. The Salvation Army has had an enduring presence in the area and opened a hospital there in 1945. The hospital has had a massive impact to the local community. The hospital had the equipment and means to test people for HIV. A mother who's HIV positive can pass the disease on to her child during pregnancy and childbirth or through breastfeeding. Having HIV makes people more susceptible to other illnesses. The children were perhaps some of the most tragic victims of HIV. In the early years, the Salvation Army worked with pregnant women and new mothers, offering tests and treatment to help reduce the transmission to their children. In 1996, new drugs called antiretrovirals, or ARVs, became available. After 5 years of legal battles with the pharmaceutical companies, prices began to fall and affordable drugs started to become available. However, 20 years on, only 1/3 of the 6 million people in developing countries who need ARVs were able to get access to them. Patients at the Salvation Army Hospital and Chikankata were some of the lucky ones, as the hospital distributed ARVs to patients. The provision of antiretroviral drugs made a massive difference to people's lives. It stopped the virus multiplying and therefore it slowed the progression of the disease, and people could live another 20 or 30 years with the disease. That didn't mean that people did not become ill or die with HIV. There was still need for care teams to treat those who already had the disease. The Salvation Army put a lot of effort to treat people with the disease, but it also went to great pains to send care teams into areas affected by the illness as well. In the Kibera slum in Nairobi, Kenya's capital city, most people don't have access to running water, sanitation or health facilities. When these images were recorded nearly 20 years ago, life expectancy was just 46 years old. HIV infection was very high. 1/4 of the Kibera population was living with the disease. As the death toll rose, so did the number of orphans. The Salvation Army used its community centres to run daily programmes for orphan children in a warm and welcoming environment, offering the children a basic education whilst giving them a wholesome midday meal. At this time there was 100,000 orphans living in Kibera. The Salvation Army's work with orphans offered solace in a time of unimaginable hardship. Today, the Salvation Army still cares for people with HIV and AIDS throughout the world, treating people in hospitals and clinics and supporting them in their own communities. It's working to reduce the spread of HIV and to break down the stigma of the disease. The Salvation Army is helping to make life better for people living with HIV and AIDS. The Salvation Army's message to people living with HIV/AIDS is that this is not the end of the road. There's hope. People can still lead positive lives.